अस्सलामु अलैकुम औज़ु बिल्लाहि मिनश शैतानिर रजीम बिस्मिल्लाहिर रहमानिर रहीम। तो आज हम बात करने जा रहे हैं टकयासु आर्थराइटिस के बारे में। टकयासु आर्थराइटिस के बारे में। टकयासु आर्थराइटिस क्या है? तो Takayasu arteritis, it is a vasculitis. And what is vasculitis? It is an inflammation of the blood vessels. Inflammation of the blood vessels, तो ये इसकी एक टाइप है। अब इस क्लासिफिकेशन में देखते हैं कि कौन से जो है क्लासिफिकेशन का कौन से ग्रुप में आता है। तो हमने इसको ऑन द बेस ऑफ द साइज ऑफ द ब्लड वेसल्स आर्थराइटिस को वास्कुलाइटिस को डिवाइड किया था, लार्ज वेसल वास्कुलाइटिस, मीडियम एंड स्मॉल वेसल वास्कुलाइटिस। तो हम देख सकते हैं Takayasu arteritis कैन बी classified under the large vessel vasculitis. So it is a large vessel vasculitis. Also it can inflame also or damage also the medium and small vessel vasculitis. Lekin mainly it is a vasculitis of large vessels. So coming towards its definition. So what is its definition? So it is a granulomatous vasculitis characterized by the transmural scarring and thickening of arteries. Granulomatous vasculitis means that it will consist of granuloma and other features of granulomatous inflammation. And second, that granulomatous inflammation is a chronic inflammation. Chronic inflammation. And it is mostly characterized by the scarring, transmural scarring. Transmural means that throughout the thickness of wall. Throughout the thickness of wall, and it is the ultimate result. It is the ultimate result of Takayasu arteritis or the granulomatous vasculitis. Although there are lesions which can be in several stages, so it is the ultimate result of the granulomatous vasculitis, and there is a thickening of the arteries due to intimal hyperplasia. We will see later. क्या होता है इसमें? ट्रांसम्यूरल स्कारिंग होती है और आर्टरीज की थिकनिंग होती है। And it involves mainly the aortic arc and the main branches rising from it. तो इसमें क्या होता है? Mainly involve aortic arch or the main branches which arise from it. For example, if we can, it is a heart and it is the aortic arc. So it involves mainly this aortic arc and the main branches arising, for example, the carotid arteries, the subclavian arteries, etc. Now coming towards its symptoms, signs and symptoms. So it mainly involves the arteries arise from the aortic arc. So there will be ocular weakness, there will be the neurological disturbance, and this is mainly due to the involvement of the common carotid artery which arise from the aortic arc. There may be marked weakness or absence of pulse in the upper extremity, and this is due to the involvement of the subclavian artery. And due to the absence of this pulse or weakness of this pulse, this disease is also called as the pulseless disease. There is no pulse or weak pulse in the upper extremity due to the involvement of the subclavian artery, so it is also called as pulseless disease. So it is an important point, pulseless disease. There is claudication in the upper limb, and this first claudication, it is the pain associated with poor blood supply, to the area. So there is claudication in the upper limb. There is chest pain due to involvement of the intercostal arteries or the area involving the chest. And there is hypertension, and this hypertension is due to the renal artery involvement in which the stenosis occur. Stenosis occur in the renal artery, and it can lead to hypertension. Now, most of the features of the Takayasu arteritis or aortitis are same as the giant cell aortitis. Giant cell involving the aorta. Most of the features of the Takayasu arteritis are same as giant cell aortitis, except that the giant cell aortitis is mainly present in the adults above 50 years of age, and it involves all the female. In contrast to this, क्या होता है Takayasu arteritis क्या होता है? इट मेनली अडल्ट में होता है लेकिन बिलो द 50 ईयर्स ऑफ एज। और ये क्या होता है? इट मेनली इन्वॉल्व्स यंग एशियन फीमेल्स, यंग एशियन फीमेल्स। इट prevalence is much more in the Asian and young females, Asian females. Coming towards its cause, it is mainly an autoimmune, it has mainly an autoimmune etiology. So now coming towards the morphology, इन ग्रास मार्पोलॉजी, हम सबसे पहले ग्रास मार्पोलॉजी के बारे में पढ़ेंगे। तो हम ये देख सकते हैं ग्रास फीचर्स में कि देयर इज़ थिकनिंग ऑफ द वॉल ऑफ aorta. Aorta wall is thickening and this will leads to the decrease in the lumen size. There is the intimal hyperplasia and wrinkling due to hyperplasia. There is wrinkling and hyperplasia in the intima, and also the vessels are thin. The vessels are, so you can see in the picture that they are thinning of the vessels at the site of vasculitis. Towards the microscopic features, so in microscopy we can see the lesion at different stages. We can see the lesion at different stages, and these lesions can range from the adventitial mononuclear infiltration, as we already discussed that the wall of the vessel consists of three parts: adventitia, media, and the intima. So there can be only the adventitial mononuclear infiltration. There can also be inflammation or perivascular cupping of the vasa vasorum. So what are vasa vasorum? So vasa vasorum are the blood vessels which supplies the outer portion of the thickness of the wall. For example, this is a blood vessel, this is the lumen. So the inner portion is mainly supplied directly by the blood flowing through the lumen of the blood vessels, but the outer portion are supplied by the arteries called vasa vasorum. So if there is inflammation, can lead to damage to the vasa vasorum and inability of these blood vessels to supply the outer portion. So there will be damage to this portion and thus the blood vessels. There can also be transmural mononuclear infiltration throughout the vessels of the blood vessels, and it can lead to the ultimate stage of the granulomatous inflammation, which is characterized by the giant cells. As you can see, these are the giant cells, etc. There is also intimal hyperplasia. As I have shown to you, this is the intimal hyperplasia, and there is adventitial fibrosis if the inflammation is healed by fibrosis. There can also be destruction and fibrosis of the media. There can also be destruction and fibrosis of the media, along with the infiltration by the giant cells. As you can see, there is destruction of the media of the aorta.